Male prostate cancer survivors, this video is for you. If you've gone through therapy or treatment for prostate cancer, if you are concerned about sexual function, bodily function, and you want to get some information and also know the best things that you can do to get back to optimal function in these areas, this video is going to help out with information, setting some expectations. My name is Dean. I'm the founder of Manful Yoga. I've got Lance here, who is a pelvic floor specialist and physical therapist. This is something that he deals with patients on a daily basis in his clinic. I'm going to turn it over to him, and he's going to tell you some information that's hopefully going to help you a lot.
All right, guys. So like Dean said, my name's Lance. I have a pelvic floor practice in Atlanta, Georgia, where I predominantly see men with some form of pelvic floor dysfunction. And when patients come in after any sort of cancer treatment, they're coming in for therapy for usually some form of erectile dysfunction or with leaking or incontinence issues. So I hear this issue all the time from patients, and one of the most common complaints I hear is that I wish I would have known that it was going to be like this. My doctor didn't tell me this was going to happen. And one of the first things I do with patients in the clinic is make sure that I set expectations that usually whenever we're going through the rehabilitation after cancer, symptoms may resolve anywhere from 6 months to 2 years after they've had whatever treatment that they've had done. And so making sure that people understand that this isn't a quick solution after they've gone through any sort of cancer treatment is always step one whenever they come through my door.
Got it. And some people, just depending on how much radiation or how much therapy they received, they might not ever get back to where they were before.
Fortunately, that is a possibility, depending on if you had some sort of surgery where your prostate's been removed, or if they've done radiation or chemo that has fried the tissues down there to the point that wherever you were at before your treatment is likely as developed as the tissues are going to get. And so therapy doesn't always work for people after they've had cancer.
Got it. Well, that's good to know. But if you're an optimistic person or you want to take matters into your own hands, there are some things that you can do. So Lance, what are those things that we should focus on when it comes to rehabilitating?
So step one is learning how to isolate and recruit these muscles and connect, making that mind-body connection to develop strength in the pelvic floor muscles specifically. And then once that connection's made, then we start to incorporate and recruit those muscles into other larger movements like a squat or a deadlift or a lunge.
So if we're learning how to isolate the pelvic floor muscle, do you have to do that in person, or can you learn to do that from like a video?
So obviously it's helpful if you have a professional there with you to help make sure that you're doing it correctly, but it's not absolutely necessary if you don't have a pelvic floor PT near you. There are definitely ways that virtually or even through this programming that people can start to target and isolate the muscles and then start to work on developing strength.
Would it be possible to create a 10-minute follow-along video where we can show people how to engage the pelvic floor and then also how to integrate it into strength training?
Didn't we already do that? I thought we already had a video.
That's right, we did that. So guys, if you're watching this, if this applies to you, we do have a 10-minute workout you can follow along to free. It's here for free on the Manful Yoga YouTube channel. It'll be the link in the description below. But before you click on that, please be sure to like this video, leave a comment if you have some feedback or a suggested topic to cover. Subscribe so you don't miss out on future videos. Manful Yoga and just yoga in general is really good for strength training. So this is a great way for you to recover. And then make sure you follow Lance on all of his channels.
You can find me on YouTube, Instagram, and TikTok, all at Lance in Your Pants, or you can check out my website, flexptatl.com.
Cool. All right, guys, if you haven't clicked that video yet, it's right here. Do it. And how often should they do it?
At least every day, ideally twice a day for the first 6 to 8 weeks is a typical program.
All right, there's your homework. I'll see you guys in the next video.